Thank you. Welcome, everyone. I'm going to start sharing my screen in a minute. Are you able to see my screen at this point or not? I think I clicked it once, but I may not went through.
Not yet.
Nope,
Not
still
yet.
seeing you.
All right. Thank you. Give me just 1 second. Can't find my shared point, but I am looking for it right now. In a minute. For some reason, the Zoom is disappearing on me. Can anyone else pull in the slides? Perfect. Can everyone see the slides?
Yes, I can see them.
Yes.
All right. Sorry about that. Well, welcome everyone. We are here. I'm joined with all of the pre-STEAM groups, the PMHCAs, and my pre-STEAM colleague is going to be assisting us today during the collaborative meeting with Emergency Medical Services for Children and Quality Improvement Collaborative with PMHCA groups. And we are going to be recording part of the collaborative. We will stop recording during the times of splitting up in discussion groups. Just wanted to all make all aware of that. This is our last collaborative out of the 3 opportunities we had this month. So looking forward to talking and learning more from the teams today. Next slide. So I wanted to remind everyone that agenda for today is we are going to be drafting Smart AIM and talking about measures and the concepts of the Dana-Bedia model, as well as the concepts of where we find our measures, the resources, and who are our partners in this endeavor, and how do we find that information and include it in our SMART aims, as well as next steps for our collaborative. Next slide. So we've wanted to recap our prior meetings. And as you recall, at our February collaborative meeting, we've had our several partners joining us. Those were Emergency Medical Services for Children, state partners programs, as well as emergency departments that were participating in ED Stop Collaborative in the prior year. So we've had several questions from groups whether or not we will welcome our partners back, and the answer is yes. Please give us the information of who you would like us to invite to our next September, well, actually last September collaborative meeting, and we would like to learn more from those partners and welcome them back. So please reach out with any questions or just provide emails, and I'd be welcome to block their calendars for that time. I believe the meeting will be September 12th. The next slide. Thank you. So today objective is to identify the SMART aim, or learn how to, as well as identify current measures that groups are working on, and the resources that they are using to identify those measures. Quick reminder, this is our pathway of education and training. Our prior pathways this month were, as you recall, resources, community resources, as well as which escapes me right now, provider consultations. Here you go. So today the focus is on education. Next slide. All right. So there are several ways of engaging with ED staff, and training certainly is one of them. There are various ways of measuring success of the training and education, and we'll talk more about that today. So education and training is the pathway for today's presentation. Quick reminder, we talked about, we're ready for another slide. Thank you. Looking at a different screen. Thanks. So SMART aim. Remember the SMART aim is an much a narrow aim and has a measurable objective, and it's much more inclusive and specific than a global aim. The aim statement is a clear, explicit summary of what your team's hoping to achieve over a specific amount of time, including the magnitude of change you will achieve. I do want to remind folks that we had a office hour on February 1st where we've um, spent an hour talking how to draft a SMART aim. And with that, that is available on our website. But also do remember that we are available to you. We have QI coaches and data analysts standing by for a one-on-one consultation at any time. And the next slide, please. All right, this is one of the examples that we've been discussing in the past, but this is a great SMART aim one could use to mimic off of or use it in your work. I just wanted to provide that example. Next slide. All right, so you might have heard that we use this term a lot, and quality science, healthcare quality science, and the term is the Diana-Median framework. So what is it? This is a model that can be used to align our knowledge in the context of healthcare delivery. In this model, there are 3 types of measures displayed here. So the 3 types of measures are the structures, which are the settings or environment where care is provided, as well as the process, which is the delivery method of and a coordination of care that occurs within that setting. And the lastly is the outcomes, which is uh, where we're looking for to kind of marry up the 2 prior measures and say that the outcomes, it's actually the impact that focusing on the health of the patient themselves and or the population that we serve. Quick reminder here, we had an office hour on March 26th that was recorded that has a deeper dive in the concepts of Diana-Median model framework as well as measures. Please feel free to re-look at it again, and it's available at any time, and you can watch it at your leisure, as well as consult with us. So next slide. All right, this is time where we're gonna, I am looking forward to that time, where we're gonna split up into teams. We have 2 teams today, and we're gonna go by 2 different rooms. So please pick a room. If you see your state under certain room, please pick that room to assign yourself into. Hoping we have a little time. By our note takers or facilitators. So would hope that there's a few minutes we can just reflect on what been learned in group 2 and group 1.
I can go first. That's, I don't know where Hannah is. So I will try because we learned so much and there was so much great things. So if I forget something, the team members already told them, just kind of interrupt me or put it in chat. So we heard first from the Chickasaw Nation. They're doing a great process and it sounds like they have a strong evaluation team behind them that they're contracting with or is working on surveying what type of trainings would be most effective for their provider base in the emergency departments and measuring the different areas, performance measure areas to identify what percent confidence and then also competence in different areas. So that informs the different trainings that they're providing and creating Sounds like they have a group of people that are also helping them create some of these asynchronous trainings that the providers have been asking for. They, knowing eating providers, they have unpredictable schedules, so they would like to do it on their own time. So they're using kind of asking, they've been able to already utilize some information, unique situation where they can actually provide gift cards for people who participate in the different surveys and give the feedback. And then lastly, they I last time I met, I listened to them. They were having trouble finding a way to provide and track the CEUs or CMEs for providers. And so it sounds like they have successfully met that goal. And they are using the Indian Health Service. So that is one of their things that they've tried to do. So their smart aim, let me read it real fast and then I'll move on to the next one. So their goal would be, I wrote notes.
That's okay.
They're specifically for ED providers, implementing a knowledge needs assessment to establish a baseline that training, establish a baseline training to explain. I don't know what I wrote there, sorry. They're going to create a platform based on a needs assessment over the next 12 months. All right. Faster is Oklahoma. So they're doing something similar. We're in education. Their goal is to increase engagement of at least 10% of training on their training website, and then by the end of this calendar year. So that would be about, I think I got the numbers right, from like 958 to 871. The number of clicks. So they're using Google Analytics. They were thinking outside the box, and they identified that why create more education when we can just make it more accessible. They have amazing education already available, but their data collection, which is why you have to do the data collection, identified that not a lot of people were watching them. So instead of continuing to like spend their time making more, they're creating a kind of a creative way so that people don't actually have to pay or go into the CME website. They can do it without CME credits, hoping to attract more people, hoping to get more traffic. So more people are educated and focusing their time with that.
Thanks, Angela. It was a great summary. Also, just as a quick FYI, I'm going to drop the evaluation survey in the chat. So if anyone needs to leave early, please take that. Okay, I'm good.
Thank you. And Hannah, report from the team first. Team one.
I could do the report, or I was going to ask if Dina wanted to do it since she was very engaged. She wants to do a quick summary, or do you want, I don't know, we should go through the aims or just.
We are a little bit at the time press, so we can do a very quick overview. Dina, go ahead if you're ready.
Yeah, so I'd just say, like, Anna gave a really nice overview from the Vermont team and where they were at with their work, sharing the SMART aim. I don't have it specifically written down. I don't know if you have it in front of you.
Yes, I do.
Anna.
As a matter of fact, I'll jump in. And so the aim for the Vermont team is to train over 200 pediatric facing staff in the ED to achieve 90% positive ratings, which is excellent / good from attendees with over 70% indicating increased understanding of trauma response, responsive care on post-training evaluation. So we thought it was a great SMART aim.
Yeah, we thought the SMART aim was good, and we just made a recommendation to maybe be a little bit more specific about the type of training that they would actually be providing and evaluating. So that was one recommendation, but we thought it was very well written. We had a really nice discussion just with the Michigan group and just really how they're trying to keep actually looking at engaging with community partners and providers to see how they can actually keep kids out of the ED. So that was a really interesting discussion. We didn't actually get to like the SMART aim and how it was all built out, but that's kind of where they were headed. And then we also had some discussion with the Delaware group as well. And I don't have the notes in front of me.
Yeah, it's okay.
I can mention some of it.
Yes,
Yeah.
go ahead, Hannah. Wait, guys, 2 minutes, come on. We
We're
gotta
doing
get going.
good.
The good thing about Delaware also is talking about a pilot program, so they're trying to get data from schools right now. The main thing is prevention before the ED, so that's one of their main focuses. So pre-hospital work, making sure they're engaging with these kids so they don't end up in the ED. So providing those services ahead of time. Is that correct?
There you go. And just a
then-
quick question was from the Michigan team, and I don't know if the other group have heard this. Just before we left, we were discussing the training for not only providers but other disciplines in the ED. If anybody's approaching that, and how were they doing this? So we'll follow up by email. I know we are at the time, but more to come. It was an invigorating discussion. Hopefully, people got what they needed out of it, and we'll keep talking and keep discovering. All right,
I
with
think,
that, I'm
Anna,
gonna
with
give.
that last part, I think like was
Yeah.
really probably like just we'll take 30 seconds. That was really the most exciting part, I think, was really having that great discussion about how best to provide and engage with the ED providers because their shift work, and how do you capture individuals on day shift and afternoons and night shift, and should it be self-paced? You know, Tennessee's doing some stuff with being self-paced.
Yes.
But then Michigan's really in some discussions about, you know, perhaps we try to tie it to another event that they're actually having at the hospital with the emergency department to be able to engage with them. So there was a lot of really good discussion.
Yes.
Yeah.
All right, I'm gonna let the floor go to Jen for our final conclusions.
Sure. So again, please complete that evaluation survey that's in the chat. Again, what is this work all going to lead you to? And again, many of you are probably already doing it, but as you're setting those SMART aims and really defining it, what it is you are looking to achieve, from there, it's really testing out the different interventions that are going to hopefully lead to your change effort. And so again, really answering some fundamental questions in the work that you're doing. Again, as you're implementing those small tests of changes, always asking yourself, what are we trying to accomplish? How will we know that a change is actually an improvement? And then what change can we make that will result in an improvement? So again, always having those 3 questions in the back of your mind as you're conducting each step of your different activities. So again, and we talked about the Plan, Do, Study, Act. Again, it's a fancy way of saying just incremental actions. So we've been doing a lot of planning. Again, a lot of you already passed the planning and you're actively doing. Just think about when you're doing, how are you tracking whether or not the things you're doing are making an improvement. So always have that in the back of your mind. How are you tracking improvement? And again, what we'll go over more in June, as well as in person, is the creation of a key driver diagram. Again, this is more of a visual aid to really help guide your work. So again, while we are getting very specific with your SMART aims, we seek to do that with this kind of visual diagram. Again, trying to just organize all of your thoughts and all of your planning into something that is clear, concise, and keeps you on track and really helps avoid that scope creep. Again, this is a very complicated example. We'll send these slides out, but again, you can see how detailed a key driver diagram can become. But also noting that a key driver diagram, while it looks very static, it is a continually improved living organic document. As you test things, things are going to work, things are not going to work. Again, using this document, updating it as you learn new things throughout your project work. All right, so this is our last session for the month. For our collaborative sessions in the month of May, we have a number of upcoming webinars for you to look forward to. Again, we are doing another office hour around data platforms. May 7th is a revisit with Trevor Covington on the application of disaster preparedness and what that means to you. May 21st is Emergency Department Provider Insights. So for those teams that were with us last year, and you remember Ann Dietrich from Clemson, she is coming back. We love her so much. She'll be here to present. She's a really good individual to brainstorm with from an ED perspective. She's an ED clinician, and she absolutely loves this work. So we highly recommend teams to attend that. June 13th webinar, we're continuing the work through of our toolkit. Again, just trying to work through pieces, parts, just to not overwhelm folks. And then June 25th, office hours. Again, highly recommend this one, that key driver diagram, that really complicated looking document. We'll be walking you through on how to create that if you haven't already created it. Whew, a lot going on. And then if you haven't already, signed up, I did send out a communication for our Cleveland meeting in July. Again, that's July 22nd through the 24th. The 22nd is a travel day. So actual meeting days are all day the 23rd and half day on the 24th. So I sent out travel information. If you have any questions, email that email. Otherwise, you can reach out to myself or Anna. We are happy to share any information with you.
And this is going to be a fun one. We have lots of good activities you guys going to enjoy. So please consider if you haven't yet.
Yes. All right. Cool. Well, with that, we'll let you go. Thank you for hanging out. 3-ish minutes past the hour. Have a wonderful rest of your week. And again, any questions, comments, or ideas after this meeting, please feel free to reach out to us.